Good morning. So today's patient had lost a little bit over 200 pounds. Previously with me, she'd had a body lift and her arms and her breast. Now she returns for her medial thigh lift. So on her, she has a moderate amount of excess skin and fat from the groin all the way down to the knee, and some lipodystrophy or excess fat on the outer thigh here. So I'm going to be doing two things. One, getting rid of the excess skin and fat on the inner thigh, and then getting rid of some of the excess fat on the outer thigh. Doing liposuction on the outer thigh, and then making an incision from the groin down to the knee, and resecting a pretty large elliptical area of skin and fat from the groin down to the knee. So first thing I do is liposuction, and then we'll take out the skin and the fat. So let's go to the operating room, and I'll show you how we do it in Beverly Hills. So we're just about to start our medial thigh lift. So I'm going to do liposuction first, removing a lot of the fat. Then I'm going to get rid of a lot of the excess skin. And what I'm planning to remove is all this between this line and this line. So remember this, because I won't be able to grab it soon. It'll all be nice and tight. So all this loose skin will be gone. All right. So what I'm injecting here is tumescent fluid. This allows the fat to float in solution and allows for better liposuction. And the other thing it does is it minimizes the blood loss during this procedure. And the next thing it does is it minimizes the pain both during the procedure right now and then afterwards. And then the next thing it does is it helps with my dissection plane. By doing this, it really separates the fat from the underlying fascia, or that layer on top of the muscle. So this step I think is very critical and crucial to a successful inner thigh lift. So I put my tumescent solution in, and it's doing its magic now. And next thing I'm going to use is this called power-assisted liposuction, PAL. It's made by Micro Air, and the nice thing about this is that the tip vibrates. And that vibration allows for better fat extraction and less blood loss, better contouring, and less surgeon fatigue. So I really think this is the best device out there for strict liposuction. Now we're going to come in, and we're going to vacuum out a lot of that fat. And you can see it's almost pure fat here. And some tumescent solution that allows that fat to sort of float. And we just come in here and quickly remove a lot of fat very efficiently and effectively. Also aids in the dissection plane between the deep fat and the fascia, which is where you want to be. And knowing my landmarks and with this tumescent solution, you can ideally keep away from the major veins in the leg. So on the inner thigh, we've got about 1,700 cc's of fat and a little bit of tumescent solution. There's a little bit of blood in here. All the red you see is not pure blood. It's a lot of tumescent solution. So 1,700 in a pretty quick amount of time from the inner thigh of just the fat. So that's a very good yield. And now we're going to go onto the lateral thigh and get rid of some of this fat. First of all, tumescent solution. So I'm going to remove everything from this line to, I hope, down here. And look at all this skin. Boom, boom. She'll have very good result after this thigh lift, medial thigh lift. So I've done my liposuction, and that removed a lot of the fat. It also allowed me to speed up the dissection here. And now I'm basically separating the deep fatty layer from the fascia, which is this thin layer on top of the muscles, which you can see here deeply. So it's a combination of digital dissection with my fingers, as well as with the scissors and electrocautery to get to approximately the 6 o'clock position on the posterior thigh here. And then I'm going to rotate this skin up and remove a pretty large piece of excess skin. So right now I'm just dissecting down to the back of the thigh. So what I do is I put a set of towel clamps on the anterior portion of the incision, and then I put a guesstimate of what I can resect way down here with the towel clamps. And now what I do is I measure between my hands the tension in the proposed excision. If it's too tight, well, then I try to take a little bit less. If it's too loose, well, then I move the towel clamp and try to take a little bit more. So I usually check this 3 or 4 times to be sure I can resect all this and get it back together, because you don't want to take out too much, because then you have problems. So I want to make sure that also we take out enough to give her really outstanding results. And so I'm just checking the tension between these 2 flaps, and it all feels really good. And one final check before we do the excision, and then I'll show you how much skin we're planning to take out. So this is what I'm going to resect. Here's a ruler. This is 6 inches, so I'm resecting at least 6 inches. It looks like probably more like 7.5, maybe 8 inches on the inner thigh here, from groin to knee, and that's what I'm going to excise. Now we're going to put it all back together, and she's going to have skinny thighs. So that's my plan, and one last check here. Yeah, it likes you best. So I'm just about to start this thigh. So you can see there's a lot of fat here, a lot of skin here, a lot of girth to the inner thigh. And here you can see after the thigh has been reduced in terms of fat, in terms of skin, I've put my deep layer and my runner layer. I've got 3 more layers to do on this leg, but this is almost done. You can see a significant difference between before and after. So this thigh is going to turn into that thigh once I get rid of the fat, once I get rid of the skin from here to about there, and it'll turn into a nice skinny thigh like that. I'm about to get started on the inner thigh, and what I want to remove is everything from here to there. So I want to get rid of all this excess skin. So all this is just hanging there, not doing anything. I've defatted the underside of this, so the dissection plane should be pretty clean, and this is what I want to get rid of. So let's do it. So here we are on this side, and we're about to resect skin from where my fingers are down to the towel clamps. And you can see by this ruler is about 6 inches, or this ruler is exactly 6 inches. And we can probably get out about, on this side, looking at about 7 inches, 7.5 inches on its maximum. And from the knee to the groin. So this will really tighten up her thighs, give her nice skinny legs. So this is just excess skin and fat. It was just hanging there on our inner thighs from a 200-pound weight loss. So let's go ahead and get rid of this and skinny up her thighs. Shake a leg. So I did my liposuction. We took out about almost 7 liters of fat, and then I removed the excess skin and fat of the inner thigh, and she's all closed up now. She's got very, very small thighs compared to where she was this morning, and she's going to be very happy. I'm going to have her in a compression garment for about 6 weeks minimum, while all the swelling goes down and the scar flattens out, and that's how I do a medial thigh lift. There are many ways to do a medial thigh lift, but I think this is the best way, where you combine liposuction with an incision from the groin to the knee. So thanks for joining us.